Sure.
It is something that's had a huge global impact. I mean, the economic impact of this thing is beyond what we can really process.
Yeah. So this is exciting. I am right now headed to the office of Dr. Kirby Farnsworth. He has agreed to speak with me and answer some questions about his take on the virus. Good morning. How are you guys doing? Good. I'm here to interview Dr. Kirby. Dr. Farnsworth, thank you for meeting with me today. I really appreciate it. I feel like there's so much information floating around. It's overload, and I appreciate the opportunity to get some information directly from someone who might have a little bit more accurate insight into some of this stuff.
Sounds good.
First of all, please just introduce yourself.
Okay. My name's Kirby Farnsworth. I'm a family medicine doc here in Peoria, Arizona. We run a private practice, a cash-based membership practice called Simply Direct Health. So we see people of all ages, from birth to a little bit older than birth and everywhere in between, based on a fixed monthly membership fee.
So today, obviously, I'm here because of this COVID-19 coronavirus. And the other day, Thursday, I think it was, I got a call and someone said, there's a run at the grocery store. There's lines out the door. Everything's flying off the shelves. So I thought, oh, that seems insane. So I grabbed my camera and I went down there and I looked. And sure enough, the grocery store is pretty empty and has been since. What do you think of that?
Yeah. People are trying to be prepared for potential problems or downfalls or negative outcomes with this whole conversation. I think obviously there's differences between what the media portrays and what maybe we know so far. Yeah. So there's definitely not a lot of toilet paper, not a lot of water. It's good to be ready, good to be prepared with the most recent updates about kind of the social distancing is a phrase that's been used a lot. So we've been trying to help people better understand what that means, and we don't necessarily need a 12-year supply of toilet paper in order to create this social distancing we're talking about.
Let's talk about the virus itself. So tell me what you know about just the virus itself, technical side. What is this thing? How does it spread? What does it cause if we catch it?
Sure. I don't work for the CDC. I mean, there's plenty of guys that know a lot more than I do. But what we do know is COVID-19 is a type of a coronavirus. Coronavirus actually is one of the most common causes for the common head cold. Mm-hmm. So it's a type of virus. COVID-19 specifically is one that's come out of the Wuhan city of China. Mm-hmm. It is a novel virus.
What does that mean?
Novel virus means that it hasn't been in the communities before. So it's a new virus. Mm-hmm. So nobody's immune to it because nobody's been exposed to it before.
Gotcha.
So likely it came from animals. There's some discussion about where the origin of this thing was. Sure. It likely came from some market animal exchange at that point. So it is a novel virus, which means we don't have information about it. We don't have vaccines against it. We don't. People haven't been infected with it, like maybe a common head cold or even something like the flu, the influenza virus. So being a novel virus, there's lots of data points and information that we don't know. Started in China. Estimated to be sometime in January. We're not entirely sure exactly when the origin was, but it has been exponentially growing since then in better parts of Iran and Italy, and then now into the United States, specifically in Washington and New York and California, the places we're concerned about.
Yeah, there's a lot of panic.
Yeah, I think so. And I guess the reason is, one of the reasons is because of how it's been described as being spread.
Mm-hmm.
It's being spread more of like a droplet or a hand contact spread, similar to the common cold. So if we're sneezing in our hands, if we're out in large groups of people and spreading the same kind of circulated air, or touching different objects, specifically touching our face,
Right.
that's one of the ways that we can spread that to ourselves and to other people. There's what's called that T-zone, where the eyes,
Okay.
the nose, and the mouth, kind of this area is a lot of where this virus gets circulated.
Okay.
So we have to be very, very careful of that.
Mm-hmm.
And some of the data points, some of the information that we've been able to understand is that it's more likely to be more harmful to those that are currently ill,
Right.
have an immunosuppressed state, somebody who's on chemotherapy or an immunosuppression that takes medications for certain conditions, the elderly, the very old, the very young, which is kind of similar to the influenza virus as well.
Sure.
That a normal, healthy individual probably is going to be okay. But
Okay.
the biggest thing that we're worried about is that transmission from
Right.
that healthy person to grandma, grandpa,
Right.
neighbors, friends, whoever that would be,
At higher risk.
at a much higher risk. And that's
Sure.
where we're seeing these mortality rates kind of skyrocket.
What do you know about the symptoms? Average person like myself, if I contract this, what should I be watching out for?
So this type of virus really targets the lower respiratory system. So when you think about, there's obviously two parts. Upper respiratory would be in the sinuses and the nose, congestion, those type of things. Lower respiratory is going to be kind of below the pharynx, so down into the lungs. So cough, congestion, wheezing, shortness of breath, associated fevers. You're going to have that normal reaction to a virus, where our body can sometimes generate a fever.
Okay.
So those are the main characteristics, and one of the challenging parts about that is that's pretty common in a lot of different
Right.
diseases in
Right.
this season.
'Cause that's my question. How do I tell the difference between that and the regular cold or flu?
Honestly, there's probably not much of a way that you could delineate that,
Right.
aside from exposure to somebody who has already been diagnosed with,
Okay.
or in a different location is a high risk area.
Right, okay.
Such as kind of these nations that have
Yeah.
had pandemics and other
Yeah.
issues. So if you've had recent travel to places like Italy, Iran, at this point President Trump is even saying Europe in general,
Yeah.
to really focus on your symptoms based
Right.
on where you've been, because that's where the virus has
Well, you
been.
kind of touched this, but as a generally healthy person, if I contract this virus, is it a danger to me?
Generally speaking, no. Most people, well, not most people, there are some people reported as being completely asymptomatic. Asymptomatic, no fevers, no cough, no shortness of breath, no symptoms at all. The hard part again becomes that carrier state, where if we're
Right.
not doing our best to wash our hands and to create a little bit of distance between us and those that would be primarily at risk, then we've got to do our part to help minimize that. But
Sure.
for the vast majority of healthy people, I wouldn't be concerned in the overall mortality or overall sickness of how people get based on their overall health.
So it seems to me like the priority of it is to do our best to keep this virus away from the elderly and those that have other health conditions who are at risk.
Right, I think so. When we compare things like influenza has about a 0.1% mortality rate. So of all the people that get the flu, 0.1% of those people will actually suffer from complications and end up dying.
Okay.
Whereas right now the data points suggest that this coronavirus, COVID-19, is roughly about 3 or 4% mortality rates.
Okay.
So while it is a lot more potent and maybe even more dangerous in some respects, that mortality rate is higher relative to the influenza. So we do need to be that much more careful.
Right.
There's plenty of more influenza cases across the country, obviously. There's hundreds of thousands of cases.
Right, sure.
But the mortality rates that we see so far, and granted this is still the middle of March and we have a lot of data that we still need to obtain and process, but right now with those mortality rates being dramatically higher than that of the flu, we need to be that much more careful to those people who are at risk.
And the data that we have so far comes from a region that is much different culturally than our own. So
I would say much different culturally as also demographically. So even their age range, so even those specifically in China and parts of northern Italy, their ages are dramatically older than the vast majority of the United States. So we have different data points. It's a little bit harder to project what these two different communities are having and kind of extrapolate or interpolate that into the United States.
Statistically, it's possible that may impact the United States in a much different way than it impacted these other areas. Is that right? Yeah.
Right, absolutely. I think the demographics of the United States is so much different than those two specific places that it makes it very much hard to predict.
Sure. In the Philippines, they're panicked. They've got Manila locked down, they're locking down other ports, and as of this morning when I woke up, the entire island of Luzon is now under enhanced quarantine, meaning stay inside your home except for absolute necessity. Do you think that kind of reaction to prevent the spread is warranted?
I think we are taking the right steps. There's this phrase that's out in the medical lingo a little bit that talks about flattening the curve. So if we think about the medical resources available to handle a major pandemic or epidemic or a medical illness, there's only fixed resources available. We can't build hospitals overnight. We can't have people graduate medical school tomorrow. I mean, the system has a certain fixed point where if we flood that area so quickly,
more people
then we can't catch up to it and more people get sick. If we can flatten the curve and push out this illness, not necessarily the number of illnesses, but the timing of those illnesses, then our resources can catch up to it. And so while I think that there's some pretty dramatic steps that are taking place even across our country with closing national events and all the sports events and everything else that's been going on, I think that measure does help flatten the curve and help the social distancing that we've been kind of hearing so much about. It will also help maybe not prevent the spread of the disease altogether, but delay the timing of the disease.
Which will reduce its overall impact.
Which in theory, the idea is that it will reduce the economic load, it will reduce the burden, the healthcare burden, and overall lessen the impact in a grand scheme of things.
I'm not a doctor, I'm an engineer, so I think of the spread of a virus and I'm picturing, okay, so we're locking everything down so that nobody gets sick, but that doesn't eliminate the virus. So, my question about that was, are we just postponing the inevitable because it's going to make its rounds, I would think, right? But the way you're explaining it kind of makes more sense.
Yeah, I think it is going to make its rounds. I don't know if there's much that we can do to really isolate this. I think we may have been past that window of complete isolation. So the idea is that this virus has been shown in some studies, some reports say that an individual that has the virus can expose between 2 and 3 people. And so that extrapolation, just like an algorithmic scale, can go through the roof. The thing that we're worried about, though, is the timing of that spread.
Yeah, I got one comment on YouTube that someone said, what you Americans aren't understanding is what we here in Italy have seen is that the exponential spread of the virus overwhelms the medical system. People need ventilators and there's not enough ventilators.
Right. I think I read another article, and again, we can get some resources for you if you need to, but
that'd be great.
That talked about there's roughly 1 million ventilators in the world. You can't just make them tomorrow. I mean, and so there is a fixed number that we need to sort of reallocate. And again, that conversation about flattening the curve and spreading that out so that, one, we can use those appropriately and potentially recover and benefit from, instead of stacking and having that the nightmare that is Northern Italy right now just be overwhelmed with their health burden right now.
Okay, so let me ask you this. lockdown quarantine in the United States is, I think it would be difficult to impart, right?
Sure.
So we as individuals, what should we be doing? I mean, should I be locking myself in my house and avoiding contact altogether? Or should I be going about life as normal? Or just, what precautions should I be taking?
I think it's a combination of the two. I think using your best judgment as far as avoiding unnecessary travel, I think is smart.
Mm-hmm.
I think rearranging travel, and most of the companies, the airline companies and travel agencies have been relatively willing to work with that if you want to wait on hold for 6 or 7 hours.
Yeah.
But avoiding unnecessary travel is probably important. There's no reason for us to take the extra risk if we don't need to.
Right. Makes sense.
I would say that going about your daily activities is probably reasonable. I don't know that I would say go to your 150 or 300 person gathering gala for a dinner. I would probably recommend doing things at home rather than going out for the next couple of weeks until we get some more data points.
Okay.
Definitely washing your hands.
Yeah.
That 20-second deal is real. Sometimes people don't know how long 20 seconds is.
It's
the ABCs if you want to get through the whole song, and then between your fingers as well. And the hand sanitizers on a regular basis. Try to avoid touching that T-zone that we mentioned a little bit earlier, the eyes, the nose, and the mouth. And really focus on potentially avoiding handshakes, needing ways that you can spread that to other people.
Should I go to church?
I would say using your best judgment. I think there are ways that you can have a church service at home or remotely or online, or if you're in a large group setting, I think that risk is higher than a smaller group. So if there's only 10 of you at your church group, then I think you're fine. Mm-hmm. If there's 1,000 of you there, then I'd use more caution and reconsider.
I guess, and my question is, on that, tailing off of that, if I go to church, am I really at risk? Can I keep myself safe?
You can. I think there's all these masks that no one can find on Amazon anymore.
Yeah.
There are different ways that you can minimize that. Again, washing your hands. Essentially, I guess the studies show about a 6-foot bubble.
Okay.
Meaning if I were to cough in your face and you were roughly 6 feet away from me, then the likelihood of me spreading that becomes much less. Sure. It's a function, it's an algorithmic function as well. Okay. Where that risk becomes lower. So if you are going to go out and be social at a little bit of a distance.
Mm-hmm. Be smart.
And be smart about it. The thing right now is that we don't know a ton of data points.
Right.
We don't have vaccines. Right. We're working on a few.
Yeah, right.
We just don't have that quite ready yet. And for the vast majority of people, again, this is going to be a head cold based symptoms, a little bit of fever and some cough and congestion. Mm-hmm. But we want to make sure that we minimize the potential spread to those who are really at harm's way. So
I've seen some advice online, and as a doctor, let me ask you for a little more insight into some of these. And you mentioned one is the mask. People are going nuts to buy masks. They're hard to find. They're getting expensive. Is wearing a mask in public as a healthy person, is that effective at preventing contamination, infection?
I would say if you don't have symptoms, then wearing a mask is probably not as important as if you are having symptoms. Right.
I've kind of told people my own, just understanding, if I wear a mask as a healthy person, that's not going to keep me from getting sick. But if I am symptomatic and I wear a mask, it'll keep me from spreading it to others.
Yeah, and I think it also depends on the mask. The size of the virus is very, very small, and some viruses can actually penetrate through the little fibers within the mask. So we have to be a little more cautious with that when we've got symptoms that suggest it. But for the majority of the transmission, especially the droplets, so the snot and the congestion that we build up, usually the mask will catch that. So that helps prevent that type of a spread from a contact.
So some other things I've seen, ginger. Drink ginger tea and you will become immune.
I haven't noticed any evidence that supports that. Ginger is very commonly used for an upset stomach and very effective for that. but I have not quite seen any evidence to back that. If somebody's got some more information, I'd be happy to read through it. I just haven't come across it yet.
At this point, you wouldn't trust that.
At this point, no.
How about this one? Garlic water. Gargling garlic water will build a shield of protection in your throat and keep you safe.
Garlic has some antiviral properties in it. I don't think that we've learned enough about this novel virus to determine if garlic does have those antiviral properties. So at this point, while it may make your breath smell a little bit, it probably isn't going to hurt you, but I'm not sure that it's going to help either.
Okay. And the latest one that I saw yesterday, a banana a day keeps coronavirus away. There's people right now who believe that eating bananas will make you immune to the virus.
I like bananas. I got nothing against bananas, but I don't know that there's any data that supports that that I've come across. Again, if you've got some information, I'd be happy to hear it, but I don't know that I'd trust that at this point.
I got one discussion online. The person was saying the vitamin B6 in the bananas or something that would build an immune.
Yeah, I think you'd probably have to have quite a bit, maybe more than one banana to build that type of water-soluble vitamin build up in your system. That might be maybe a bushel of bananas. I'm not sure.
So maybe some of these things, what's your thoughts? The garlic, the ginger, the bananas, or just, eating healthy in general. Obviously, it's important to keep our immune system strong during this time.
Right.
So, but the other things are still critically important. Wash your hands, social distancing, keep that bubble, those kind of things.
Right. I think while they probably aren't going to hurt you, things that you've mentioned before, I think more importantly is this idea of reducing the potential transmission to yourself from this T-zone, to wash your hands effectively, to create this social distancing so that we can flatten that curve that we talked about a little bit earlier. I think that is going to be one of the biggest things that we can do as an individual, as individuals, for the greater good in the community. I think obviously getting the right exercise, getting the right amount of sleep, getting the right amount of dietary intake and nutrition, those are all very, very important to your health, and they're probably more important than we even think so. But in that respect, I think if we can solidify those things and then add those other reminders to maintain proper hygiene and to take care of ourselves and those that we care about, that's probably going to be more beneficial than anything we could strum up.
I think there's a lot of people that even today don't understand what good nutrition means. There's so many fads out there, right? People think that to be healthy means to be vegan, or to be healthy means to be vegetarian, or now to be healthy means to throw your body into ketoacidosis. So, all these different things and fads are out there. I'm not asking you to answer what the right thing is to do, but where can we find trustworthy resources to look up what we should be doing to keep ourselves healthy, what nutrition and exercise we should really be following?
Yeah, I think one of the biggest resources would be your primary care doc. I'm a firm believer that primary care and prevention of disease is really what this world is shifting to. So there are studies that show if you've got a primary care doc, you're less likely to die by a magnitude of 15 to 30% from premature illnesses. There are studies that show that having a primary care doctor on your team can really help guide you in the right path. There are tons of data to support that conversation. So sure, it's a plug for what we do as primary care physicians, but I also think there's some backing behind that. You have to have a conversation with those people that you trust, maybe not the ones that you read about on the interwebs, but those that you trust, to understand that why organic is important, why unprocessed, unpackaged foods are valuable, and what the processing part takes away from in some of the nutrients. So the antioxidants that are built into these things, the different colors of vegetables and the importance of vegetables, and how if we eat more vegetables we're less likely to die, and how if we eat more fruits and green leafy vegetables and different things that we don't have to prepare as well or open a package, how those have natural value and prevention in helping us live healthier. there's a slew of different websites from things like nutritionfacts.org that goes through different scientific-based evidence research supported trials of what we need to be doing rather than what people sometimes think that we should be doing.
Right.
And a lot of times there's not a fancy pill that fixes that.
Sure.
It's a lifestyle switch.
Lifestyle.
So lifestyle medicine is now actually a new thing that's been in primary care to help us support activity levels, sleep, and nutrition. So this academy of lifestyle medicine has been created so that we can augment those three facets in our lives to help fine-tune those as best we can to prevent any of the long-term complications of things like medications or fad diets or other things that we know to have short-term benefit, but usually if people go on a fad diet, the studies show that they actually end up gaining more weight than they've lost in the long run. So those are some of the ideas and some of the places that you could veer to look a little bit more into how to improve your nutrition.
Are you aware of any particular websites that we can check out to get information about nutrition and staying healthy in general?
Dr. Dave Rakel has a fairly good website through his academic institution, the Medical College of Wisconsin.
Okay.
They've got an integrative medicine branch that's full of really good information about how people can maintain their health. Actually, the government of Western Australia has a ton of resources for our mental health. Things like anxiety and depression and how to improve activity levels and those type of things. And then again, nutritionfacts.org is one website that I use frequently to help. It's got little podcasts or little modules that you can say, hey, what is this fad? What is this? Is this true or fact or fiction, myth or reality? Through a lot of different nutrition varieties. So
great.
Those are really good tools that I use on a regular basis and recommend to a lot of my patients.
Great, thanks for that. Any final thoughts about the current situation? The virus itself?
I do work a little bit in small town emergency rooms, and so I follow it fairly closely. We get lots of updates as far as what COVID-19 is doing and what we can expect. I do think we're going to find more cases maybe get worse before it gets better as far as identifying these cases. I think there's a lot of people that are working day and night to try to help create things like vaccines and other ways to limit this spread. It is something that's had a huge global impact. I mean, the economic impact of this thing is beyond what we can really process. And so I think it's up to us to really help, without being redundant, flatten that curve and do our due diligence for those in our communities that would be at higher risk. And so if we do our part, washing our hands, if you got a fever, cough, congestion, stay inside. You can call your office. A lot of times your primary office can triage things through a telephone call rather than bringing that to other people that potentially could be sick, or try to use those resources that you can and really just kind of hunker down for another week or two until we get some more information.
Sounds good. Sounds good. Well, I really appreciate you taking the time.
Yeah, my pleasure.
I know your time's valuable, and I think you're doing good work.
Hopefully we can help impact people for the better and work with it from there. We should have practiced the Wuhan kick. Have you heard of the Wuhan kick?
Great. I appreciate your time.
Thanks. Yeah, no worries. Anytime something like that comes up, let me know.
I thought that was pretty great. Very informative, very helpful. I hope that some of the information helps you. I know it helps me, and it's nice to have an official perspective from someone who knows what they're talking about rather than just reading all the gossip and rumors. Dr. Kirby Farnsworth is a really fantastic guy, in my opinion. He's built this practice and been very helpful. He focuses more on keeping people healthy and preventative medicine rather than simply focusing on medicating people who are already sick. Figures that it's better to stay healthy and not get sick than to just make money off of helping sick people recover. So I think this is going pretty well. That's exciting. We got an interview with a medical doctor and got to sit down with him, and I mean, you know how hard it is to sit down with a doctor and talk about something, right? So to be able to spend almost 30 minutes in an exam room, sitting and asking whatever we wanted to ask. That's pretty cool. I'm excited about it. All right, that's it for this one. I'm gonna go edit this interview together and get this online as quickly as possible. Until next time, stay safe, stay healthy, keep your family healthy,